Hello everyone. I'd like to take this opportunity to thank you all for attending our little webinar on the nurse paramedic placements in primary care. Um, we're hoping that the following information we present you will be able to assist you with supporting these fabulous new learners in your environment and to help you see the potential of this new dual role, either within your team at a GP level or at a primary care network level in the future. I'd like to introduce, we've got two speakers today. We've got Eleanor Fenny, who is one of the senior lecturers and is the programme lead of the new MSci Nurse Paramedic course at the Faculty of Health, Social Care and Medicine at Edge Hill University, who's going to talk to us today give us a bit of an overview of the new dual registration programme and a little bit about the expectations of what they would require for their clinical placement experience within primary care. And then we've also got Alicia Gregson, who is currently a second year learner on the MSci Nurse Paramedic course, about to go into her third year, and is going to be one of our potential learners for this placement. And she's hopefully going to talk to us about her experience so far as a learner on this programme and her hopes and expectations of a placement and potential career in primary care going forwards. At the end, there'll be a bit of time for questions. And as a bit of a reminder, we are recording this for our colleagues who were unable to attend today. Thank you very much. I'm just going to pop on the slides for Eleanor and introduce you to Eleanor Fenny.
Thank you very much. Thanks, Sarah. So hello, as Sarah said, my name is Eleanor Fenny. I'm one of the programme leads for the MSci Nurse Paramedic programme. So essentially the programme is, could you go back to slide 1, Sarah?
Is this slide 1 now?
The what is it slide?
Yeah, I'm on the what is it slide. Is it not sharing it?
No, it's still showing slide 1. That's okay.
No, it's fine. It's not showing the right.
There you go. That'll do. It's obviously taking its while to think about.
It is. It doesn't want to work today, does it? Oh wow, what's going on?
That's okay.
Oh,
that's okay. I'll carry on, and then if the slides pop up, then brilliant. If not, I've got them here as a backup, so I can always jump on and share my screen if it all goes horribly wrong.
It won't share it in slideshow mode for some reason. I don't know why.
All right, that's fine. Don't worry.
So can you see the small slide?
Yeah.
All right, we'll just have to do it that way. Sorry, I do apologise.
That's okay, no problem at all. So essentially, the MSci Nurse Paramedic programme is an undergraduate programme. It's pre-registration and it's 4 years full-time. It's fully integrated and it's the first fully integrated adult nurse and paramedic programme of its kind in the UK. And as far as we know in the world, although I hasten to make that claim because you never know, somebody might come up and say, we did one too. It is very unique. The focus of the programme is obviously very much about creating this integrated dynamic practitioner who's got this ability to be able to transfer skills across pre-hospital, hospital, community and primary care settings with an understanding of a very good understanding of the healthcare landscape and some of the gaps that we currently see that we feel that this practitioner can definitely do something innovative to address. So the students are developed from day one as nurse paramedics. They obviously have the option to decide at the end of the 4 years to register and go off and be an adult nurse if they choose to do so, or be a paramedic in their own right, because they have the registration capabilities to do both, and they are simultaneously registered with the NMC as an adult nurse and also with HCPC as a paramedic upon qualification. But that's not the hope for these guys. We've been working with them since the very first day to get them to start to think differently and think about the impact that their novel scope of practice might have as a practitioner and how they can positively affect patient care. So that's kind of where we started with them, and hopefully that's working so far. I'm sure Alicia will be able to give you her thoughts on that as we move forward. So can you flip to the next slide for me, please, Sarah? Thank you. So as you can imagine, we've had to map the curriculum design and all of the proficiencies for practice and all of the requirements for the programme to both the NMC Future Nurse standards, which were the new standards that were brought out last year, the year before, even in the midst of COVID, because, you know, we like to do things during a pandemic. And also they're mapped to HCPC, standards of proficiency for paramedics. We additionally went a little bit further than that and considered the College of Paramedics curriculum guidance, and also made sure and mapped thoroughly a lot of the content and curriculum to the College of Paramedics requirements. There is a significant overlap, as you can imagine. You know, when you're talking about the heart is the same as whether you're a paramedic or a nurse. But at the same time, there are some distinct differences, and obviously we focus on those just as much as we focus on the similarities when we're delivering the curriculum across the whole programme. Okay, can you flip to the next slide again for me, Sarah, please? Thank you. So there are some distinct key features, obviously, particularly in relation to practice for these students and individuals. Because it's such a blended curriculum, they do learn the transferability of skills in particular, and knowledge, and that's really useful for when they come to deal with patients directly, because they know and they have the skill set to be able to deal with patients within any given setting. And that's replicated throughout their practice journey so that they can very obviously identify those skills which are transferable. The part of the programme focuses on retention and attrition, and we've worked very closely with a lot of our stakeholders in practice to develop the programme, to involve them in theoretical elements of learning, in inclusivity of things like IPL, and also within their assessments as they move through the programme and develop their academic learning as well as their practice learning. Their practice areas are specifically defined by skill set as opposed to a particular placement allocation, so they're not identified as part of either a nursing or a paramedic placement. They're identified as to what we would have an expectation for the proficiencies that need to be met during that placement area. And I'll go through those as an example on the next slide. And we are utilising a modified version of the London PAD with their approval, which will be converted to online PAR from September. So they will be consistent with some of the other student healthcare professionals that you tend to see and offer placement opportunities for. Okay, thanks Sarah, last slide. Marvellous, thank you. So as far as the practice journey goes for the students have theoretical elements which underpin each of their practice opportunities. And as you can see, they get quite a wide variety of placement opportunities throughout the entirety of the programme. All of the placements are a significant length, so they're anything from 5 to 7 weeks in length, which gives them the opportunity to get a good level of exposure in each particular area. In year one, they do the equivalency of the NMC PAD 1 document, so they are classed as nursing first year students within a practice setting, but also with those paramedic elements and HCPC requirements built into that. In year two, they undertake 3 placements: an ambulance-based placement, mental health and critical care placement, which are all of 5 weeks in length, so they get a really good grounding in each of those areas of practice. And then in year 3, they get another ambulance-based placement, which is again focusing on that opportunity to examine how transferable their skills are across patient assessment in different settings, child and family placement, and then supplementary care placement, which is negotiated by the student. That gives them the opportunity to go off the traditional circuit, so they can access charitable services, homeless services. We've got some going to SEN schools to work with special educational needs children, sexual health clinics and services that aren't traditionally areas where student nurses or student paramedics would have the opportunity to develop an understanding of those areas of practice, and also primary care as part of that. And this pilot is forming part of that supplementary care opportunity. And then in year 4 they have an international opportunity, which is invaluable for their wider understanding of the role. And there are some established community nurse paramedic roles internationally, particularly across Scandinavia, and we've been working with Finland in particular to link up with them. And so we're doing that to provide the students with the opportunity to go abroad should they wish to. A virtual care opportunity, because we know that the landscape has changed, and strangely enough that was in there before COVID, but we know how much more important that is now, given the changes in the way that we patients access us is really important. So we've included that in there. And then they have a final 12-week transition placement, which is very much led by the NMC. Even though it's not as prescriptive as it used to be, we're looking at working with the students to then develop them within that 12-week placement in their chosen employer, and start to really kind of get a preceptorship state within their placement opportunity. So that's their journey through practice. That's all I have to say as far as a summary of practice goes, and a summary of the programme. So I'll hand over to Alicia so that she can tell us a little bit about what she thinks about primary care opportunities.
Yeah, so I'm Alicia Gregson, and I'm in my second year here. I've come straight from college, so I'm a bit of like a baby to the whole primary care and any care in general kind of thing. And I chose the nurse paramedic course because I generally couldn't decide between nurse or paramedic. Like I liked it both, and then I heard about this course, so I thought, oh, best go for that. And then I was reading into like different nurse paramedics, so they've got some in Australia and Finland. And it's really interesting when you read about it, because it's like a practitioner who is fast thinking and they can get you a treatment there and then, but they're also flexible enough to do wider thinking and care planning, which is quite interesting. And they'd be able to ensure like a safe treatment plan and be able to get you to hospital safely. So that's like interesting just as a like nurse paramedic in general. But in a clinical setting, it could be like used to help with chronic conditions, so you can have like diabetes and COPD, but you can also then integrate it to out of care. So if you had like an out of care placement, you'd be able to help like with home visits and stuff, and you could spot as use your paramedic kind of cap a bit and see any spot like signs of deterioration and stuff. Like an example is if someone was diagnosed like newly diabetic, you can go and see them, and you'll be able to spot the signs straight away of like if they're having a hypo or a hyper, give them insulin, and that's your paramedic kind of bit done. And then as a nurse, you would be able to care plan, so maybe get them to see the diabetic nurses, what more they need to add and stuff like that. That's how I see it, yeah.
Absolutely. So what do you think you would like to get from a primary care placement then?
Well, I'm not really like used to primary care, so it'd be really interesting to see exactly how primary care is and know what they like, how they work and stuff, but also to be able to see like where we'd maybe be able to fit in to different, if there's any gaps, and how we'd be able to fit in there. So that'd be interesting, and get to like use your clinical skills, because you do skills when you're assessing patients, and you use all the assessment skills during primary care. So yeah, that'd be interesting.
Absolutely. Absolutely. That sounds great. Sarah?
Well, thank you both very much for that quick whistle-stop tour of nurse paramedics and how they can be hopefully valuable to primary care in the future. Just like to open the floor to any questions anyone may have for Alicia or Eleanor.
Hi, it's Sarah from Tabba PCN. I'm one of the paramedics that currently work in primary care. Just to give you a little bit of feedback of what you said, Alicia, it's absolutely true. There is a very niche market for the skills that you've got. As a paramedic coming into primary care, there are lots of challenges, and we utilise those quick assessment skills on the home visiting. And now I'm looking at care planning, of the big changes within primary care, of anticipatory care as well. So yeah, it's definitely something. You're looking at the right side of it, what we can do on the paramedic side of it in primary care. But yeah, it'd be lovely to work with you.
You too.
But yeah, we'll take you under our wing if needed.
That's really nice. Thank you very much, Sarah. if there's no other questions, I think what we'll do is we'll call it there. It's quite obvious that this new role has got a heck of a lot of potential. We're already working with paramedics in ours roles within primary care, so it makes sense to be looking at this role within primary care and seeing how we can integrate emergency care with primary care, how we can try and reduce the need for the emergency care by preventative medicine. So looking at how we can reduce, admissions and expectations of that need for acute services. So hopefully, going forwards and working with yourselves and other staff such as Sarah, who are already in a similar role, we can really make a difference. So I want to thank you both for coming today and talking to us about your role and expectations. And I'd like to thank all of you who are taking the time out to listen to this webinar today. And if you've got any questions, or you're quite excited about the idea of supporting these wonderful learners, if you just want to get in touch with ourselves at the Greater Manchester Training Hub, probably the best person to contact would be Cora, who is cora.dunwell@nhs.net, or you can contact myself, which is Sarah with an h.mccrae@nhs.net, and we will send those out in the email as well, so you'll know who to contact. Thank you all so much for coming today, and look forward to hearing from you all. Thank you.
Brilliant. Thanks very much, Sarah.
Thank you.
Thank you. Bye.
Bye. You can stop recording now, Jane.